Hey everyone, this is Dr. Jin and welcome. And today we're going to be working on our lovely patient here, tackling one of the most common issues that we have, and it's that under the chin or that submental kind of extra tissue or fat that a lot of us are trying to get rid of. Today we're going to be utilizing the Agnes device. It's one of my favorite devices in terms of helping to address this problem area. What is it exactly? It's a monopolar radio frequency device that basically helps melt away the fat. So looking at our patient here, what we just want to do is just do a quick assessment of what we're looking at, right? And it really is this area here. A lot of times people use different types of additives or injectables to help dissolve away the fat, right? But when you have limited gains from that, using a device such as the Agnes or using an energy-based device can really help with that. So in terms of looking at our target area, I'm just gonna draw out some landmarks. I'm just gonna go midline here and looking at almost a triangular area in terms of what we're looking at in terms of the area that we're gonna be tackling. So stay tuned, we'll get her numbed up and let's get going. So the original intent of this video was to tackle the submental fat, but by request, another very, very common area that we see in a lot of our patients are the jowls. And she actually doesn't have too much jowling, but we can address this area here. If we kind of turn and look around this area here, this is the area that we can address in terms of a little bit of extra fat or tissue. And so we'll do both areas. And now with any procedure, we want to clean the area and make sure we're providing a clean area to work with. Maybe a little discomfort. So we'll start on the neck area first. And this is just a numbing tumescent solution. I'll just do a lot of small injections of lidocaine, okay? Basically with the skin marker, I did a basic outline of the section that I want to do, and it's this triangular area here. So what I'm going to do is I'm going to border it along with the lidocaine injection. These are just small little micro injections to help numb up the area and make it more comfortable for the procedure. Ready? Mm-hmm. Okay. Pinch. How are you feeling?
Good.
Just give that a second to numb up. So I define my borders, and then now I'm going to go in the border. And when you have a good kind of numbing technique, this procedure really is very tolerable. It's not that uncomfortable. A couple of things to note is you always want to mark them when they're sitting upright, because when you're laying flat, it can be a little deceiving, right? You almost have the temptation to go more lateral, but you want to stay away from going too lateral unless they have a lot of extra tissue or a lot of extra kind of fat down there, because there are vessels that kind of run laterally along here, but you typically have to go pretty deep to hit those, but you can actually feel them and see them. So we're going to stay kind of more in the central area here, kind of that triangular draw out that I had earlier. How are you feeling so far?
Yeah.
Okay, good. So we'll go ahead and get started. I don't know if you can see this up close, but it's a three-pronged needle. This is I believe it's the F3A needle that we're using. So 3 prongs, you're able to cover more surface area along with this. Okay. So you shouldn't feel any pain, okay? You might feel a little discomfort and pressure, but let me know if you actually feel any pain, okay? So I want you to kind of tilt up. There you go. How's that? Do you feel sharp or dull?
It's a little sharp.
A little sharp? Mm-hmm. How about here?
On the duller side.
On the duller side? Okay. So again, if I'm looking at my kind of original landmarks, this is kind of where I want to stay within. I don't want to veer off outside of that. You ready?
Yeah, what's gonna happen?
You'll see. No, it's you shouldn't really feel anything. Basically, you'll usually hear like a singe.
Are those like little prods gonna get like?
Yeah, that's where the
like
heat.
rubbed, or is it like poked?
No, it's poked in, right? So it's poked in, and then the energy is delivered to the tips, and you'll hear like a little singe.
How deep is the line?
I believe this is I want to say 4 millimeter, so it's not too deep.
Okay.
Ready? 1, 2, 3. Do you hear that? So I'm just marching my way up that line that I made earlier. So if you listen closely, you can hear kind of a sizzle, and that's the fat that we're basically burning. So we're doing a lot of kind of pokes, but over, when you add them all together, they add up to get you that effect. But that's why sometimes with the Agnes, you need multiple treatments. So the only thing that, I guess the downside of the Agnes is you do have some downtime. You will have bruising afterwards.
But it could get covered, right? Like with makeup?
Oh yeah, yeah, definitely.
And then how long does the bruising last?
Bruising for 7 to 10 days, realistically. But what you can do is take some arnica.
Oh, yeah.
Yeah, so we'll load you up on that. Sometimes you can actually see the fat that's liquefied. That actually will come out. This actually looks like it's a lot of blood, but really it isn't. It's so crazy. Sometimes you'll see like little drops of blood, but then on the blood you'll see, what fat looks like on water,
Yeah.
like little bubbles. Like that's what you see. Good. And that is it.
For real?
Yeah.
Oh, no way. That wasn't like as bad as I thought it would. Like I said, there was just those really small points. But like with all that numbing, it was fine. Like most of the time I didn't feel it.
Good. All right, so we finished with the submental or under the jaw area. You can see there's a little bit of bruising underneath, which is totally expected. You can actually still see the kind of outline of where I injected because there's a little bit of epinephrine in the lidocaine. So when we do the jowls, again, it's really important that you mark out your areas beforehand because when you lay them flat, you're looking at something totally different, right? One of the things you want to do is, again, you want to provide enough anesthetic to the area. One thing that you want to be aware of is the actual facial artery, which is kind of coursing along up here, right? So that's where with using the Agnes, you don't want to go too deep. You want to actually stay a little superficial. So those are just things to note. All right, a lot of small injections, okay? So why don't you turn for me? Pinch. Turn, okay. Again, The Agnes, I think the only downside is the downtime, right? So you may have upwards of a week of a little bit of bruising, but this is one of the devices I really like using. It's very effective. So despite that downtime, it can really help you get the results that you're looking for in terms of gelling, again, underneath the jawline or underneath the chin in terms of getting rid of that excess fat there. Works really well. So sometimes you do need repeated procedures. So sometimes, 2 or 3 times will really help do it. Because again, despite the fact that it seems pretty invasive, it's pretty non-invasive in terms of the type of procedure that we're doing. So yeah, typically you'll see your patients back in about 1 to 2 weeks just to see how they're doing, and then you go from there. So that's it. So again, this is Dr. Jin. I hope you enjoyed the Agnes procedure, looking at addressing the jowls and the submental fat. If you like what you saw, make sure to follow me, and there you go.
That leg thing.
That's good.